What is a fractured rib? A fractured rib is when there comes to be a slight break or crack in one or multiple of our 12 ribs. This can cause shifting of the ribs, leading to deformity, roaming bone segments, and overall functional impairment. It is important to understand what, where, and how this happens to recognize and repair this type of fracture. Our bodies contain a skeletal shell-like structure called the rib cage. The rib cage is utilized for its framework to protect our vital organs, such as the heart and lungs. This internal bone structure consists of 12 pairs of ribs that are positioned inside our chest, reflected across our body's midline on either side of our sagittal plane, spanning to both the anterior and posterior sides of the frontal plane. When these bones endure a force of repetitive stress or direct trauma, it causes these bones to give in under pressure and break. After learning the fundamental body position of the ribs, we can understand what else can be affected. As a result of the injury, muscles, ligaments, and tendons around or connected to the ribs can also be impacted depending on the severity of the injury. The rib cage and all related parts play an essential role in the mechanics of breathing through facilitating the contraction and expansion of the chest cavity. In more severe fractures, the muscles located between each rib, called intercostal muscles, can become overreactive and strained due to overcompensation from taking on the additional function of the injured bones. Similarly, the ligaments that connect the ribs to vertebrae in the back, called costovertebral and costal transverse ligaments, become damaged trying to repair lost structural stability from the compromised rib. If the injury continues untreated, the effects start to mimic a domino effect as accessory respiratory muscles and tendons become aggravated, acting as a crutch for the muscles that initially reconciled for the fracture. What causes a rib fracture? The ribs can be categorized in three sections: true ribs 1 to 7, false ribs 8 to 10, and floating ribs 11 to 12. Any of these ribs can be fractured, though the most common to undergo this injury are the middle ones. As I mentioned before, rib fractures can result from various causes. Forms of direct trauma would be the impact from motorized accidents, falls, and contact sports. The most common sports and activities that have been related to rib fractures are rowing, baseball and softball, tennis, weightlifting, football, basketball, hockey, and gymnastics. The high velocity motion and force exerted, accompanied with high impact collisions and falls, make our bodies more susceptible to this injury, though any sport performed recklessly with improper technique can also have this outcome. Non-sports related factors include severe coughs and pre-existing health issues such as osteoporosis. Understanding these causes can help with prevention and treatment plans. First step to diagnosing and treating this type of fracture is understanding the symptoms. These include 1. Sharp pain in the chest or sides of the thorax extending from the axilla down to the midway through the abdominal region. This pain fluctuates with deep breathing, coughing, or movement. 2. Tenderness, when applying slight pressure to the possible fractured area. 3. Swelling and bruising around fracture are visibly telling of a fracture rib as well. If not caught in time, new symptoms and complications can present themselves and cause extended damage to the body, such as 1. Organ damage. Broken parts and segments of the rib can puncture organs, causing internal abrasions and collapsed vital organs. 2. Pneumonia. Improper deep breathing resulting from previous symptoms associated with thus fracture increases the risk of lung infections. 3. Flail chest structure. Fractured ribs and bone segments can induce improper movement of the chest wall, causing intense breathing difficulties. These effects can cause major discomfort affecting everyday life, hindering effective breathing, basic movement, adequate sleep, and emotional stability. Once identifying the symptoms of a rib fracture, consulting and following the guidelines provided by a healthcare practitioner is the initiating step towards recovery. Assuming the patient follows the proposed protocol, fractured ribs typically heal on their own within 2 to 6 weeks. Treatment focuses on preventing further complications and improving breathing and movement with minimal discomfort. 1. Reducing pain. Over-the-counter and anti-inflammatory painkillers recommended by a professional, along with occasional ice application for numbing as well as swelling. 2. Rest. Avoiding any forceful or unnecessary energy expenditure. Also, avoid prolonged bed rest while recovering. 3. Monitoring. Watch for worsening symptoms. 4. Facilitating proper respiration. Deep breathing exercises provided by a physiotherapist. The common breathing exercises recommended by a physiotherapist are deep breathing, diaphragmatic breathing, and buccal handle breathing. 1. Deep breathing. Place your hands over the injured rib area and hold a pillow against your chest for support. Slowly take a deep breath, inhaling through your nose, holding for about 10 seconds, then exhaling slowly through your mouth. Repeat 5 times every 2 hours. 2. Diaphragmatic breathing. Place one hand on your upper chest and the other on your abdomen. As you inhale slowly, push your abdomen out against your hand, while keeping your chest tolerably still, then exhale slowly, tightening your abdomen muscles. Repeat 5 to 10 times, 2 to 4 times a day. 3. Bucket handle breathing. Place your hands on the side of your lower rib cage. Inhale slowly, feeling the expansion of your rib cage against your hands. Hold your breath for 10 seconds, then exhale slowly. Repeat 5 to 10 times, 3 to 4 times daily. Common upper body exercises recommended are shoulder movements. While standing and leaning slightly forward, allow the arm related to the side of the injury to hang relaxed. When ready, gently move the arm forward and backward in circular motions and side to side. Repeat in each of these directions 10 to 15 times, 2 to 3 times a day. Any movements recommended by a physiotherapist should be done carefully, within pain-free range.